Hi, I'm Dr. Sam Hanna from Dermatology on Bloor. This is my colleague, Dr. Daniel Schachter. We were going to demonstrate today some filler techniques in men specifically. Dr. Schachter is an accomplished injector, and I certainly do a lot of injections myself. So first, I think I'm going to ask Dr. Schachter to give some thoughts about what he does in terms of an initial consultation and some issues that are specific to men in terms of cosmetic procedures.
Today we're going to talk about a new dermal filler, hyaluronic acid. It's called Revanesse, and Revanesse is very useful in this market. It's relatively long-lasting. The dermal fillers that are hyaluronic acid tend to last about 12 months. The range is somewhere between 6 and 18 months. And the nice thing about these fillers is that they can be molded easily. There are very few problems that one has to anticipate. And if one happens to want to ever remove a little bit, this is possible. The cosmetic market, as one can well imagine, is about 80% women, but there's an increased interest among men in various cosmetic procedures, including the neurotoxins and the dermal fillers. The filler that we're using, as we said, was Revanesse Contour, and Revanesse tends not to produce a lot of swelling.
I think the final comment I'll make, and then maybe we can take a look at my face and you can talk about what you think we should do, is just about the choice to use Revanesse today. I've been quite excited about having it available. It's been really living up to its promise in terms of having patients leave with less inflammation, which is really great. Patients don't want to be advertising that they did these things. They want the result, but without the obvious period of inflammation. The other thing is it's great that it's a Canadian product. It's exciting to have a product that's homegrown, so it's nice to have available to use. And then longevity, again, with these types of HA fillers that we're seeing now, including the Revanesse, it's not a difficult procedure to do, but certainly if we can do it less frequently, it's nice to avoid. So to see a year and a half, or even longer of duration is great.
Dermal fillers can be used to fill in the temporal area. Many people have a loss and a major dip in the temporal area. You can use an HA under the brow to raise it, which can also be done with a neurotoxin. You certainly can enhance various areas, like this is the malar area of the face, and there's a bit of a depression here, so this can be filled in. If somebody wants more filling laterally on the face, towards the outside, that can be done. Some people have a dip in the jawline. This is called the prejowl sulcus. Hyaluronic acid filler, an HA filler, is perfect for filling in that prejowl sulcus. So this is the nasolabial fold, and this can be filled, and it just softens.
Dr. Schachter, if patients are concerned about the injections and discomfort, are there options for them in terms of numbing?
We can use an anesthetic cream that can be put on thickly on the face. There are anesthetics that can be injected into the cheeks as an alternative.
It's always been a comfort to my patients too that products like Revanesse do have numbing agents mixed into them. So as you begin to inject, that does reduce the discomfort of the procedure significantly as well. Great, well, I'm ready to get started.
We're going to clean the areas off with chlorhexidine. Okay. Try not to get in his eyes. Revanesse Contour is for volume. We're going to use this where we need volume in there. And we can use Revanesse Ultra or Revanesse Contour for the nasolabial fold.
Yeah, and I find the Contour really does have a nice capacity to lift where we want to see lift in both male and female patients. Whereas the Ultra has a nice lift capacity, but it's a little softer, so I like it a little better around the mouth for patients. In the lip, we're not going to be using it today, but there's a softer product, Reviness Kiss, which has been really nice in augmenting lips in a natural feeling way. So it's nice to have that range of products. And there are others in the Reviness line as well, but those are the ones that I primarily use.
So we're going to today inject the center of the face, and he's got a little bit of a depression here, and we're going to soften his nasolabial fold here, and maybe a little bit lateral area.
And this is something I'm sure you find, like I do, that as you go, you may, what your initial plan was might evolve. As you treat one area, you may find that you need to do a little less or a little more in an adjacent area.
Right. So we're going to start in the mid-cheek groove here, and there's a nerve supply here, and so it's possible with the lidocaine in the injectable that this area will be anesthetized. So we're just trying to distract him a little bit, and just like that. We're going to pull back a little bit on the syringe and inject. How do you feel?
I feel great. Just about nothing.
We're going to just go very gently. You're okay?
Mm-hmm.
Just gentle. Pull back. This is a very easy product to inject.
I think the little bit of bleeding that might be happening, I don't know what your experience is. I certainly feel like because of the increased blood supply related with the bearded areas in the face, I think men do tend to bleed just a little bit more sometimes. But we'll often talk to our patients ahead of time about avoiding things that make them bleed more.
Such as?
Aspirin, ibuprofen, alcohol, some herbal and vitamin supplements.
Vitamin E?
Vitamin E, vitamin D, vitamin A and K, I think, as well. And then a lot of herbals, ginkgo, ginseng, garlic, as supplements, not necessarily as dietary issues. Are you aiming for absolute symmetry in general? Is that the target?
Well, if there is a deficit or a defect, then we will fix it. But in general, if we just try and make it softer, gentler, and make the person look younger. Sometimes we make them look happy. We can turn their lips up. Sometimes they want bigger lips. And again, there are other things that some people notice that can be changed. You know, you can raise an eyebrow. You can sometimes fill a defect or a scar anywhere on the face. So again, we see that this is the mid-cheek groove, and it's not exactly the same as on the other side. I think that it was deeper on that side. So we're going to, again, distract him like this, tiny pinprick. We pull back, and usually we're going down to the bone, to the periosteum, but not always. You have to be very careful in this angle between the nasolabial fold and the nose because there are very important vessels. So you want to inject very slowly and maybe not too much. As I pointed out, some people have little wrinkles in front of their ears, and sometimes they have a little wrinkle in their earlobe, and if Dr. Hanna wants me to get rid of this little imperfection in his earlobe, I'm happy to do that. Little pinprick. So this is a very easy filler to use. It flows so easily.